Welcome back to Big Impact Louisiana, where we highlight the nonprofit organizations across our state that is creating lasting change, empowering people, as well as building a better future for all of us. ViaLink and the Louisiana Data Collaborative brings this series to you because we believe when data is more than enough, it becomes action, strategy, and transformation. Today's spotlight is an organization doing truly life changing work across Southeast Louisiana, ADAPT Incorporated. ADAPT was recently honored with the Marguerite Redwine Community Action Award for their outstanding commitment to health prevention and community empowerment. And today we're going to get a chance to dig in and talk about their mission and how they lead with purpose. And today we have here to talk with us Mr. Rusty Fournier. And I just want y'all to know at the awards that happened last week, he's a great speaker. He's inspirational. I think that if he ever does a second career, he could be a motivational speaker, maybe do TED Talks around the country.
Well, as long as you didn't set the bar too high on that introduction, I think we'll be okay. Well, it is an honor to be here with you. I greatly appreciate this opportunity, and the award for the Marguerite Red Wine Community Action was a beautiful setting there at the Tea Room in Audubon. Violink just did an amazing job pulling this event off, and it really means a lot to be recognized for such, with such a prestigious award. So I just want to say thank you right on the top of things. And yeah, we can get started whenever you like here. So, you know, this is just going to be a conversational kind of thing. We'll talk a
Yes.
little bit, and hopefully everybody gets our little sense of humor, and we'll go from there.
Okay. So my first question is, can you share a little bit about the mission of ADAPT and all of the great types of programs and services you're providing?
All right, thank you. So the mission of ADAPT overall, let's try to bring this in a little bit. So, what we want to do is we want to address the causal factors that lead to sexual assault, violence, substance abuse, and all these different problem behaviors that we have in the community. And we want to address those across the board, right? So everything from prevention to interventions to post interventions to treatments and supply the needed resources along with collaborating and networking with other serving agencies and all, because this all takes a collaboration, right? Ideally, we would like to be able to do the prevention work, then we would never have some of the issues, right? But we do have the issues, so we need to be able to offer the treatments,
Mm.
whether that's counseling services or it's trainings or in services or information or whatever it may be. It really is a desire of ours to have the community become healthier, more productive, have better outcomes at the end of the day. That is our overall mission, is to have a healthier community in which people have options, and we all want to be happy, right? So go ahead. Here's the deal. We'll learn right off the back is I can go on and talk forever about all this kind of stuff, and it's good information, but we have a schedule and you have questions, so we want to try,
No,
try to
you're
stick.
good. You're good. So what are some of the most pressing needs that you've been seeing right now in the community that you serve? And also just share like the areas, the parishes and the areas you're serving currently.
I'll hit the areas and all, and also need to give kind of a background or a 10,000 foot overview of some of the programs and all that we operate.
Mhm.
So we primarily operate in Washington, Tangipahoa, and St. Helena parishes. Okay. We are a accredited sexual assault center, one of only 11 in the state of Louisiana,
Wow.
tier three for parish and all that, cover Tangi and St. Helena. Like I mentioned, we do domestic violence in combination with that. We also work with peer support and recovery services, so addiction counseling, some case management with that. And once again, this is the high altitude overview because as you get into the weeds, there's a lot of things that make this happen. We are the fiscal agent for the Washington Parish Coalition on Human Services, which is a phenomenal organization that's been around for 20 years, 22 years
Mhm.
now. Brings together multiple different sectors and all. it's a great way to collaborate, communicate, work together, network, know who's doing what services are being provided, but also a chance to identify gaps in services and figure
Mhm.
out how we can fill those gaps in services. We operate the Washington Parish Youth Coalition. We started this. This is a coalition of young people, junior, senior high age level. We started in 2014 with about 6 kids. Currently represents over
Oh,
186
wow.
members, and it represents every junior, senior high in Washington Parish. They've been nationally recognized and all. It's just a fabulous program. Primarily learning about substance use, none just say no stuff. This is actual real true education,
Mhm.
leadership development, peer-to-peer type development and all. They do a wonderful job. And we work with a lot of, you know, DCFS, child advocacy service centers, law enforcement, DA's offices, hospitals, and on and on. So we do a lot of different things that contribute primarily on the social and behavioral health type of programs, all in an effort to have better outcomes for our communities. Yes.
That's great.
That actually answered the question. I realize I kind of went around in a circle there, but
No, that was perfect. And we got to learn about some of the great stuff that y'all doing and how y'all are growing.
right. And we work with we work with divergent programs and other things as well. And it really is good.
Hmm.
It's making an impact. So we can, and I don't know if you want to leave this or I will, but we use like your data
Hmm.
all the time,
Oh, we're going
right?
into data already. I love it.
Let's talk data a little bit. In order for us to be successful and understand that what we're doing works, so whether it's a facilitated program, some evidence-based type programs, whether it's some type of treatment options or whatever the case may be, in order to know that we're being effective, we have to track, we have to have data.
Hmm.
iLink is a wonderful partner in collecting not only data but the resources because we can't all do everything, so we have to
Right.
build the relationships. CCYS, Caring Communities Youth Survey. We got qualitative and quantitative data over the last 11, 12 years showing
Oh,
that what
wow.
we do in the Youth Coalition works. You can see the declines in substance use and alcohol use over the years. So we know that it's working. We do listening surveys. We use United Way's Alice reports. Very good, right? So and of course federal level data as well from U.S. Census Bureau and others to be able to track what we're doing, how we're doing it, see if we need to reevaluate or maybe we need to expand or adjust depending on emerging trends that are coming up, right? So data is key and vital for us to be able to not only verify that what we're doing is working, but also know which direction we need to move as well.
Yeah, the great thing about that is all of the things that you named is like you don't always have to, everyone doesn't have every piece of data. There's a lot of data out there that we can use that is happening in our own community and collaborating with people. And I think that was really powerful for you to remind people that, there are other sources that you can help you come up and create different things. Now, with that data that you just recently, you've been collecting over this time, how exactly are you managing it just to make sure, you are being able to look at and identify those different trends or even shape the programs based off of that information that you are collecting?
Very, very good question. So we also real quick, we also, when you talk about local data and all, we
Hmm.
do our own listening sessions, but we also, from the sheriff's office, from the coroner's
Okay.
office, from all these different local locations, we get specified data, that really helps us pinpoint different things. So we actually you have a data coordinator that
No.
really helps put things into, spreadsheets and all these other things so that when we're looking at, depending on what it is that we're addressing and we need the information for that, we can go back and we can pull and say, okay, over the last months or years we've been seeing this. All right, what have we done or implemented for this particular issue, if anything, right, that addresses this one? If we have, okay, we implemented it, example, 12 months ago, right? How long did the implementation take? What feedback are we getting from this? Let me see the data that we have that's the most recent to see if there has been a change. If there's something that us nor any of the partner agencies, have are currently tackling. And it's all of a sudden it stands out in the data because we're reviewing something for something else and saying, you know what, there's a trend right here. This
Mm-hmm.
thing's moving in this direction. Who's best equipped to address this? Is it something that fits into our scope that we can do, or is it something that maybe another agency would be more suited to, and maybe we can partner with them or help out in other ways? So yeah, you have to be able to read and review the data. Always, some of the data always lags behind,
Mm-hmm.
right? It's just the nature of the beast. So when you get the big data from like the state and the feds, it may be 2 or 3 years old since the last update. Having fresher data, uh, some of the stuff that y'all collect and that we collect on our own helps us try to stay ahead of, or at least with the curve
Mm-hmm.
as things are starting to trend, to know how we can make the biggest impact on our community to help, to help combat the issues that are arising.
Mm-hmm. Also, like the most powerful thing you said, and it was pretty much how who's best equipped. Because I think that's a problem, like where we all think, because all of the nonprofits in this state feel like, oh, we got to do everything and we got to do it on our own and we got to just try to figure it out, even though we might not specialize in that. And just understanding that you don't have to do it all, and there's someone who probably is doing this better than you, and who's the best equipped to help you, figure this out. So I think that's powerful that, you make sure you always center that in what y'all are doing. That makes y'all a beautiful, powerful group. And that's probably why y'all are so good at community partnerships.
Well, I greatly appreciate that. And yes, whether you're looking at the strategic prevention framework or other
Hmm.
things, being able to identify what is out there, identify if someone else is already attempting to address it or not, and then seeing what resources you already have in place so that you know what you need to try to bring together to address that
Hmm.
situation. Yeah, unfortunately, we can't all do it by ourselves.
Hmm.
We have to, well, I shouldn't say unfortunately. It takes a team. It's a group effort all the time,
Hmm.
and we really have been blessed over the years to work with some great agencies that really care and really want to make the changes.
Hmm. That's great. So, a part of that with you and how y'all are doing community partnerships, can you just tell me a little bit, like, what does it mean for your organization to be community centered? And exactly how have you been doing your collaborations to help expand your whole impact in the area?
Okay, so being community centered, yes, we are a community organization. Of course, we're a 501(c)(3) nonprofit,
Hmm.
community based in everything that we do. And one of the biggest ways in which we do is, of course, it's not just attending a fair, festival, or event once in a while and saying you're community based, right?
Right.
It's actually doing programs inside your service area, your catchment area that you're trying to do. Not everything's going to work for every location, even in just one parish, right? You have some that are a little more urban, some of them more rural. While a lot of the issues will overlap, they will all have their own specific things. The Washington Parish Coalition on Human Service has been just tremendous with being able to work with and see the different agencies, organizations, whether it's faith-based, community level, school systems, whatever, you know, uh, that has been wonderful in being able to expand and really make sure the impact is there.
Hmm.
People will donate their time. Their the employers allow them an hour a month to come hang out with us, and then other times over the course of the month, to be ready for calls or subcommittees and things like that. Our coalition, we may have, I think there's probably 200 signed up that are actually active members of the coalition, but every month you may have 40, 50, 60 people that are there in that meeting, and it'll be a great representation of your service area and the providers that are there and the community members and all, and getting the feedback from them and what they're seeing and being able to put that kind of one-on-one communication. So you
Hmm.
just sit there and you can talk about, what are you seeing? This is what I'm seeing. What can we do about it, right? Is this a plus? And sometimes they're pluses, right? Sometimes we have positives. It's not always negative. Sometimes we have
Right.
positive things that happen, and we want to make sure that we're all about the positive things that are happening. How can we support
Hmm.
positive? So, yeah. Okay. What was the second part of that question?
Well, you actually answered it, but so just about your whole how do you expand on your impact?
We do expand into like other geographic regions and things like
Hmm.
that. We're just based primarily in Washington Parish forever, and we would do a little bit in other parishes on a very limited scale.
Hmm.
Uh, through through our networks, our collaborations, and everything that we do, we've been asked to expand in additional service areas, and it takes time. Look, once again,
Hmm.
we're not profit. Ain't like we got 200 people that work here or anything like that. It's just a handful of us, and we all wear a lot of hats. But everybody is so dedicated and driven that they really go out there and make things happen. Right?
Hmm.
It's good. It's good.
And a part of, you having such a dedicated team is a lot has to do with also your leadership. So I just wanted to talk a little bit for you to just describe what's your leadership style and how do you feel that is helping to shape the culture of your organization?
Wow, talk about a tough question. So, I need to think about this one for a second, but my leadership style is I'm a doer,
Mm-hmm.
right? So I go out there, I'm on the forefronts. I'm never going to ask you to do something that I don't do myself. Uh, I really and truly, like I previously stated, I've been very blessed to have some really good people. And if you have good people around you, that makes you better, right?
Mm-hmm.
We are driven. It's a business. There's no two ways around it, right? So we have things that have to be done, right? We
Right.
all love the administration part of all the paperwork. That's like all of our favorite things to do is paperwork, right? Those are the things that you have to do that's
Mm-hmm.
associated with the things you love to do is when you're out there actually working with the community, working with the youth, working with those different entities, and you're seeing that change. So my leadership style, they may argue with me, but I'd like to think is really just being on the forefront, and kind of saying, this is where we need to go and
Mm-hmm.
being able to communicate because I'm always open for any ideas and suggestions, right? If you want to take charge of something, you better be able to take criticism as well. So,
Ooh, look, that's a good quote right there. You want
so
to take
yeah,
charge, you should be able to take criticism. And yep, I love that. That's a good one.
you cannot be closed-minded. It's a human trait that where we'll get focused on something and we'll put our blinders on and we'll ignore other things that are telling us, hey, you may want to do A, B, C, or D. And that's where your coworkers come in that can help you, but you have to be willing to listen to them as
Right.
well and respect their opinions and try to see things from a different point of view. And by the time you're able to collaborate, because when we look at things, it's a process, right?
Hmm.
We have ideas and we talk about it and we do a rough draft and we'll say how's this going to impact and we'll do that and at the end of all of it, it may be a couple of days or it may be a few months. you know, we've all come together and we've said, okay, we think this will work.
Hmm.
So leadership style, I would hope would be engaging
Hmm.
and setting the tone by doing.
I love that. I love that. So, one of my final questions is, what is on a horizon right now for Adapt? Any new programs or goals that you're excited about, or new things coming up that we should be looking out for?
As we're all aware, there are multiple changes currently
Hmm.
happening. So like everyone else, we're reading everything that comes down and some stuff is just in a holding pattern because we've actually got several programs where we're looking to try to work with those who are being released from jail
Hmm.
have had substance use issues and all that, and trying to do a lot of work in that field to help reduce the recidivism rate by making sure everything's set up and ready for them. They know where to go to get A, B, C, and D. Offering continuing enhanced case management and peer support services and all these types of things. We're looking at expanding different services in our areas of Tangi and Santa Elena and trying to reach more rural and unpopulated
Mhm.
areas as well, which is always a challenge, right?
Right.
Uh, those challenges have to do with, well, we're in 2025. Y'all know I just got high speed internet 2 weeks ago at my house.
Wow.
I mean, look, and that's the reality of where
Right.
we live, right? So that is a big drawback. Transportation is a big issue. So working
Yes.
to try to make sure that we can meet people where they are so they can be educated, informed, receive services that they need. We always have a lot of things that we're looking forward on. How can we make sure the individual that needs some type of a service, how can they receive it
Hmm.
if there's extenuating circumstances for one, two, three? So yeah, we're always looking to improve. We're always looking to enhance. Uh, Expansion is something that it has to be done the correct way. You know, you got to make sure you have the right people in place to do it. And we want to make sure what expansion is a slow process because we want to make sure what we're doing right and we're doing well.
Hmm. And how can we, the viewers, everyone support Adapt? What is the best way to support you guys?
Thank you. There are several different ways now. With like our sexual assault center, we're always we're looking for volunteers. Just take a crisis line, or maybe a hospital response. Now there are requirements, right? You got to do background checks and all this type of stuff. Got to make sure you're not on the exclusion list for the inspector general. And then there's trainings, and it's a little process. But volunteers are always welcome. If people want to volunteer to help us with different events, come out and do things and promote these types of services, we can do that. And of course, we are a nonprofit, so you can write it off on your taxes if you just want to donate some cash. I'm saying. Our website is adapt, ADAPT, WP, as in Washington Parish, .org. So it's adaptwp.org. And they can learn a lot more information about us. And we can always work on options for donations if people would like to donate. Because once again, we do provide a lot of services. We do a lot with federal grants and things like that as well. Because our programs are free, right?
Hmm.
Our sexual assault service, no victim has ever paid for a service. We've been operating it since 1990. Thousands of people have come through and never requested a penny from everybody. But federal grants will only pay for so much here and there. So if like my air conditioner unit goes out, I got to have other ways to pay for that.
Right.
So yeah. And that's just the reality of it.
Hmm.
But yes, so we are more than happy to accept donations, and we will give you the receipt so you can write it off on your taxes. There are a lot of ways to help. And, if you can't volunteer, you ain't got a dollar or so to send to help donate, just help spread the word that, help is out there.
Hmm.
Let people know that there are places that you can receive services for whatever you're dealing with. And one of the big things that we do as well is we refer a lot. We try to partner with so many different agencies and organizations and really truly understand what they're doing so that if someone comes to us and let's say it's homelessness, right?
Hmm.
Uh, we don't do homelessness, but I mean, there may be other things we can help them with depending on what they're dealing with. But because of our relationships, our collaborations, partnerships, and all, we know exactly who to contact. So we can be a referral source as well to help get you in contact with the individuals you need to be in contact with.
That's great. Well, I want to thank you so much for coming on the show today. And I just want to thank your whole ADAPT team for all y'all are doing in the community and helping move things forward, as well as just connecting and collaborating and just doing all the great work. And V-Link, we were really honored to recognize you guys for the Marguerite Community Action Award. And I'm even more honored that you were able to come on the show and talk about some of your great work. And to let everyone know, if you want to learn more about ADAPT, we will put the link to the actual video, to their website on our YouTube as well. So you'll be able to go and share some of the information and make sure that you're donating and volunteer when you're in the area. Thank you so much for coming today.
Thank you so much. It's been an honor.